All right, thank you for joining us today. We're talking about concerns about suicide in our kids and youth. And with me is Kari Tanta, and I'm going to ask her to please introduce herself.
Thank you, Laura, for having me here today. My name is Kari Tanta. I'm a pediatric occupational therapist and the manager of the Children's Therapy Program here at Valley Medical Center. I'm also a clinical professor at the University of Washington in the Department of Rehab Medicine with a special interest in advanced practice skills in the areas of emotional and behavioral disorders. This topic is near and dear to my heart.
Great, thank you. So can you first start off by telling us about the importance of emotional and behavioral health in the lives of our kids and youth?
This is one of the most important areas in the development of children, and yet sometimes it's underrated. We're often, as parents, so focused on the developmental milestones of our children, when they're going to walk, what sports they're going to excel in, how good of grades they're going to get in high school, that often we will overlook how they're feeling, if they're happy, if they're sad, if they're connected with friends. And we really want to highlight this important topic right now during the pandemic, because the whole social structure for our children, which is the basis for their development in this area, has been upended.
Okay, and what can you tell us further about what we've learned about kind of an uptick in some of the numbers we've seen with attempted suicides or even suicides overall?
Yeah. Well, I don't have specific numbers for you today, Laura. I will tell you that here at Valley, we are noticing an increase in the number of kids who are coming through our emergency room with suicidal ideation and other behavioral disorders. And across the country, this phenomenon is being shown as well. The American Academy of Pediatrics and our own Washington State Department of Health have recently come out with statements urging primary care providers to really look at this topic, and for all friends and family members to really be on the alert for risk factors and behaviors that might indicate the risk of suicide in a young person.
And what are those risk factors? You also mentioned the term suicidal ideation. Can you tell us a little bit more about that?
Yeah. Well, first, risk factors for suicide can be anything to range from having a family history of depression or suicide attempts, to things like a recent breakup for an older child or some trauma in your family, maybe a death of a family member, divorce, perhaps. Suicidal ideation isn't the same as attempting to commit suicide, but it's a trial and it's an idea. It's a thought that maybe I would be better off leaving this world. Sometimes what you'll see is a child attempting to hurt themselves, perhaps by cutting themselves, or attempting a really risky behavior like jumping in front of a car. All of those would be considered ideations.
If you as a parent or you have somebody in your life that you're concerned about, and maybe you're seeing some behaviors, or maybe it's just maybe a gut sense, what do you recommend that you do in terms of being able to learn more about that person?
Well, you hit on the one, which is learn more. So do some reading, know where to reach out, and do that before you have a concern about a young person that's in your life. Secondly, you want to not shy away from those difficult conversations. And they are just that, very difficult conversations. You want to ask the child or teen explicitly, are you thinking of harming yourself? Are you depressed? There are tools out there on the internet that you can do a quick depression screen with a child in your life. You want to ask questions about if they have ideas about harming themselves. And if they do, what is their plan?
Okay, so let's say that you actually do have somebody that they have spoken, that they are thinking about those things, or even further, that they have maybe some attempts. What are the different ways to approach that? When should you call, say, your primary care provider versus actually take your child into the emergency room?
Those are great questions. And again, there's different answers for different stages of life, as well as severity of your concerns. Younger children, it's going to be easier to reach out on your own as a parent or caregiver, to reach out to primary care, to give calls on behalf of your child. After they turn 13, there are some laws related to how much can be divulged about mental health and how much you can expect a practitioner to talk back to you. If the child is speaking with you, you're having good conversations, and they haven't actually attempted to harm themselves and they don't appear to have a specific plan, I would recommend continuing to engage in those conversations with your child on a regular basis. Likely they will open up to you more and more the more conversations you've had. I know in our family that's what happened, related to some depression, and the more conversations we had, the more our child opened up to us. If they have actually tried to harm themselves, that is the time where it is a 911 type situation. If the child is with you and is safe and has no access to a weapon or to pills or to anything else to harm themselves, you should make a call to your primary care provider, or to one of the hotlines that are quite prevalent on the internet and that we will be sharing in resources after this video. You can also take them immediately to an emergency room, and I would never shy away with that if I was that concerned about my own child.
So let's say that you have a child who's living away from home. Maybe they're away at college, or they're just living in another household and they're not living locally and you can't physically get to them. What do you recommend that you can do to make sure that they're okay?
Yeah. So great question. First, you're going to hope that your child is seeking help on their own and knows the resources that are available, say on a college campus. And I know the campuses, the things for my own child that I'm seeing, they're reaching out to families and letting them know those numbers that can be called. They're also very willing to talk in generalities with family members about concerns about their student and to give ideas as to how to encourage their student to get help. This is also a good reminder that as parents, we should have phone numbers for someone to contact who's close to our child's life wherever they are living. So try and get a phone number of a friend or maybe a relative in the area who has contact with your child before you need to. So if you don't have those numbers, try and reach out and get them, because those can be great allies to reach out to.
Great. Let's talk a little bit more about what Valley has to offer in terms of being able to get help. You mentioned being able to reach out to a primary care provider, and also what resources do we have through children's therapy as well as through emergency department and even inpatient care.
That's great. So while Valley does not have dedicated pediatric psychologists and psychiatrists, we do have supports available for kids and families to help keep kids safe and to help transition to the programs that they need. Our emergency department does a great job of triaging urgent situations, and should the child need to be admitted for safety, there's a team of nurses and doctors and therapists from children's therapy who will meet and will care for the child as long as they are an inpatient at Valley. On an outpatient basis, we also have pediatric occupational therapists who are well trained in mental health services and how to help kids build self-esteem and build leisure activities and things to help build them up in their world, and they are here and available. As well, we have a robust website with all kinds of information and resources for families related to pediatric mental health. Finally, we do have a relationship with a number of providers in the area who are willing and able to help us get the counseling services that kids are provided. And our children's therapy team does a great job of connecting families to those resources.
Great. Thank you so much, Kari, for your time. And for those of you who are watching, we will have a list of all those resources, including web links in the details for the video. Thank you.
Thank you, Laura.